all for joining. Uh, this is a fourth webinar for the series, and this time we are looking into a healthcare tech, which is very one of the kind that we are covering in the webinar. And today we have with us Balvinder Singh. He's the founder and CEO of Trigya Innovations. He brings with him a lot of expertise on development. And this particular webinar, we are very excited for this because it's one thing about what we tell about Catalyst and its capabilities and everything, but it's completely different when you get to witness how Catalyst behaves on the front lines of a patient care delivery. And Balvinder here and his team at Trigya have been instrumental in actually delivering or completely translating clinical thinking into code, which you will be seeing in the demo later today. So over to Balvinder, please go ahead and introduce yourself.
Yeah, thanks, Akshay. So good morning, good evening, and good afternoon, everyone. Because we are in the different time zones. And so myself is Balvinder Singh. I'm the founder and the CEO of the Trigya Innovations. So we are the Zoho premium partner, and we are having now is a two office, one in Haryana in India based, second we had another office in New York. So we are the 40 plus people in our team, and till now we have completely developed more than 1,000 projects on the Zoho globally. So today we are explaining about the capabilities, then some like futuristic AI based technology integrated with the Catalyst. So Gautam, can you give me the please screen sharing access?
Sure. Akshay, if you could transfer control.
Or you can continue. You can continue first, so then I can
Right.
take
So
my slide.
just a few minutes of intro into the segment itself. So we also have partners from different sides and also our own customers as well. So just a brief intro into the webinar and the solution that we're going to build. So when we were doing a deep dive into the whole industry segments, we were seeing that solutions can be built for a lot of segments, and the major segments in the healthcare industry that we were seeing a lot of cases where healthcare providers, health technology and payers, which is the insurance agencies and everyone else. And in today's webinar, we'll be focusing on healthcare providers and the solution built for them. So when we found out, even among a lot of Zoho customers within and also partners and generally in the industry, so we found these are the following challenges. The first is the need to personalize and improvise. And in today's day and age, everyone is expecting only this. And I'm sure that even Balvinder here would be able to give more such insights on
Akshay, you can't see your screen, sorry.
I'm so sorry. I'm so sorry, but are you able to see my screen right now? Yes. Thank you so much. So these are some of the industry challenges that we came across both from within our Zoho community as well as the general challenges that anyone looks to who is looking to digitize in the industry. But these are just some of that we heard. Balvinder, we would like to hear it directly from you, right, who's built the solution as to what is a major industry challenge that you're seeing in this particular healthcare industry or dental industry.
So mainly we make the easy journey start from there, and the new patient come. Nowadays, like the patient won't like if they can directly call, they need some quick URL for booking, and if even they visit on the multiple branches, so then they want a smooth exit. So like a doctor can come on the like attend them. After that, the complete prescription slip, what is their payment term. After, because there is a healthcare is specific in the dental industry, if I'm coming on that part, so they have some packages also. It's not a one time just come and give the medicine like that. So all this tracking with some make doctor side also, like doctor can easily diagnose and make a complete prescription sleep. Then they can track the patient-wise reports. So these are the upcoming challenges are coming. How to manage the patient? There is a patient report. There is every country having their own rules for the healthcare, like at least the 7 years, 5 year data we need to give in the digitalized mode. So all these thing we can cover with the Zoho Catalyst.
Right, definitely. Like these are some challenges that even I think most of us who have visited any hospitals or dental clinics have faced and are even probably facing right now. I think this must be common across every region.
Correct.
And a particular question about most of the hospitals that or clinics that we do visit are multi. They have a lot of different parts and different branches. So is this also something that needs address, or is that also a challenge?
It's challenge if we're not connected, but if we give any connected software, so then it's like today you are in the Delhi, tomorrow might be in the Bangalore, but you find the same branches there. So anytime you can visit there, their doctor also can see your all these previous histories. So then it's more easy.
Yeah, definitely. When we have faced this even within the own city, same city, we have faced these challenges. So I'm sure that going forward, I think it will be really interesting because we are going to the solution that is going to be demoed is going to address all these challenges, and how Catalyst address some of these challenges. This will be best explained in the demo that you will get to see right now, and these are just some places that we are helping in and pitching in to digitize the industry or digitize the business. And if this is something that is a problem, right, for you, please do let us know in the comments. And we also have a poll question coming up where if you had to retrofit, have you had to retrofit a solution, or is it fine that's already working, right? Already we have Zoho apps. Is it okay, or have you had the need to retrofit it to a particular industry, right? Please feel free to answer the poll question so that we can help you if needed, right? And mapping industry needs to Catalyst. I think you'll be best how Balvinder here can tell us, like, how the industry challenges or the particular challenges with this client had been translated into solutions. Can you give us more insight on what you were considering when building the solution, especially for such a industry like healthcare, which is very uses a lot of legacy systems, as well as uses a lot of has a lot of restrictions, and a lot of customizations is needed. What were the things that you were looking for in a solution?
Yeah, the main challenge, like if there is a new startup hospital, so might be they are using some tools like Zoho or any other tools are in the market or specific industry specific solution. But we developed the solution for, like, if there is a big hospital and they are running the business since last 15-20 years continue, so they must have to stick with their legacy software, like they are using Oracle, and in the backend during the development we face some challenges also. Customer is saying like this is possible in Catalyst or no, so then we are saying yes, this is possible. Okay, that time the customer also excited, and we customer, like, wherever they face the limitation in the Oracle and even the last 15 years they are using, they are afraid, like if they are update anything in that because that is a offline based software they are using, and they are not changing, they are not able to update any new features within that solution. So then they came back to us, we check all these through, and we give the commitment and deliver the solution as per they required.
Yes, definitely. Those are a lot of things to consider while building it for an industry like healthcare. So I will now hand it over to Balvinder without any ado, so that he can start explaining his demo and the complete process and the architecture for everyone here. So over to you, Balvinder.
Yeah, please give me the screen sharing access and I can present my screen.
Uh, do you see the axis?
Not yet. Last time I think
Okay,
we gave it
Gautam, can you
about changing
please
access.
give the access to Balvinder?
Done.
Yes.
Yeah, I got it. Thank you. Thank you.
Yes.
So, guys, I'm not taking much time in the lots of page PPT or anything. I have a very simple PPT with a 2 page. So, what thing we are going to cover and what is the flow chart for this? So then I'm directly jumping on the application. So today we are taking the complete journey for the patient management. How easily we can create an appointment uh, like offline, online, and tracking them. Lab operation also, billing system, HRM billing. We are using in the front end. The doctor is create a billing or suggest some treatments. So after that, we are syncing the. I'm also link this with the Zoho one application and standalone application also. So operation, we are managing the catalyst properly. There is a billing system. We are syncing all these two-way sync with the Zoho box. HRM, we are syncing with the Zoho HRM solution. But all things are managed within the Zoho Catalyst. There are some reports management. We are using this powerful BI tool. We have the Zoho Analytics. So because there is a lots of reports, more than I think 100 reports we created in this solution, and it's not possible without the Zoho Analytics solution. But we embedded within the Zoho Catalyst. Administration. These are some setting buttons. We give the master access to the client, so then they can easily create their if they added the new branch, they added new treatments, new labs. So all this role and permission we give in their hand, so that they can not come back to again and again to the developer and ask like, can you add the one more branch, one more treatment like that. So the main powerful solution, how we made this more futuristic. So then we have, this is the upcoming plan, but already planning the roadmap and did the more possible R&Ds. So we are integrating a GPT engine with the Catalyst, and sales IQ chatbot. If any patient want to put their, normally the chatbot is available, like you put their some your ID and that one. But it's something, if you ask any specific treatment or anything, so whatever documents we have on the customer website, so GPT giving the answer within that documentation, not like a global answer like that. And also for the internal staff, so this is also helpful for the data analysis and the rest of the things once we integrate the GPT engine. So the next, this is the flow chart. Let me make more specific. Okay, in this areas we are covering, like it's a front end. We are using the Zoho Catalyst as in the solution, and in the front end we are using a React.js. In the back end we are using the Node.js. So with this combination, so then we gave these panels like users have the admin permission, doctor, lab, and all these permission they have. After this, the next we have the login process. So anyone, like we send the appointment for the accepting this. So after that, they'll log in the access. We put a secure, like you said, two-factor authentication, or you can log in via Gmail, log in via Outlook, so log in via Apple ID. So all this authentication we verified. Then after that, in the backend, like this Zoho Catalyst as in the serverless application, we are using because there is a DMS management system for managing the patient documents. There is X-ray reports, all this. We are using the file storage and Zoho status for the data source. So then I'm also coming on this AI solution. I already explained, like we are putting some AI engine in the backend. So even the this doctor upload their X-ray report, so that is prescription automatically created and suggested just in which areas the patient we need to diagnose. So that is become the more easiest way for managing. So in the business flow, we are covering the appointment, then is checkup, labs assistant we have, and the billing solution. So all these 4 modules we are covering in this solution. So now I'm coming on the main application. So how it look like? So it look like really very beautiful and accessible for. We have the mobile application, like browser-based application, and for Android we are using the SDK file. Like if they have the tag in the hospital and all this. So once the users log in this application, so this is the admin access I'm having. But if the user having the access only that appointment, so they can access the appointment. So we are covering the appointments and the call center appointments for the new patient or exiting patient. Like if they have the multiple branches, in this specific case of the customer, they have the 15 more than 15 plus branches, and patient can came from any particular location. So they can receive the offline. They have the receptionist, and they receive the offline appointment. If they got any call or online appointment, they consider as in the call center appointment. Dentist appointment directly doctor also, like if they appoint, so some in rare case like doctor need to directly come in the emergency for receive some appointment, or doctor also manage the appointment. Lab internal, so this is the once the doctor diagnose the problem, so after that is goes to the internal lab, and there whatever basic checkup, like it's normally if you when there's a teeth checkup or there's a lots of things you find in this application, technical thing, and like it's a blood check and any sample they need to take from the gums. So all this lab testing they have. Even it's not for the internal customer, so we gave them the solution. Even there's a small clinics, dentist clinics are around them, so they are diagnose the problem, and they are sending the for the sample purpose within their lab. So they have the two type of the revenue model within their internal patient handling and outside patient handling also. Then the billing system and accounting, we are managing the billing in the front end here, so that the doctor can easily put and then check all these rates. We are giving the access to the doctors. Then once the billing is finalized, and you can just consider as in the layman, there is a sales order we are managing here. And once the invoice is finalized, that is syncing with the Zoho books. So whatever taxation rate as per the GST in India, as per the sales tax in US, so then we can implement all this taxation and sync with the Zoho books, all these chart of accounts. Telemarketing, we are saying like a telemarketing or like it's online digital marketing. So we are using the Zoho marketing automation behind this. So if the patient we have, so then we are triggering the WhatsApp messages, emailer also, because this is not a one time, it's not a disease. Sometimes like you need to come like it's a continue on the checkup basis. So we can offer some regular offers on the discount as well, so that patient can come and then take the benefit all this. We are covering this in the marketing, but it's powered by the Zoho marketing automation. All this data we are syncing, like the patient data we have the mobile number, we have the patient email ID. All this data we are syncing from the patient module to the Zoho marketing automation. Then human resources, all these users we are managing in the human resources module here. But it's the two-way syncing. If any new active users we have in within the Zoho people, so that user also sync with Zoho Catalyst, this particular application as well. So this is the two-way sync, but all this attendance and the biometric happen within the Zoho people. Manager, these are the specific roles we give for the manager. So manager can create some discount module, some offers. So we have the manager module also here. Accounting, I explained. Administration for that admin or the IT guys. So then you can set up the lots of settings in the backend. So once the user having this module, so they can come directly. We have some quick feature also here in the theme, and it's very neat and clean. Not much distractions. If they can come on the patient wise module here. Within the patient, if I seen like how many patient came on the 6th of the May, these are the appointment, these are the emergency appointment list. They have some extra charge for the handling the emergency, and you can see the status of the patient. You can check the last date patient, any particular date you can select. If the patient is treated or not treated, then SMS if the patient is came, so then we can directly send any SMS. So via SMS, via WhatsApp, we have the template also here. So they want to send a confirmation, we are supporting the almost all language here. This is Arabic, or then we need to support in the English or any local language. So these are the templates already. We can, if once I hit that button, If we put the WhatsApp business account in the backend, so then it goes via WhatsApp. If you want to trigger only the general SMS, so then we can set the general SMS also. Now the appointment, if this patient is came back again after 1 week, so then is something like a cloning the previous application appointment. So then we don't need to refill and rework again. So if I change the status is active, so then it's comes like a new appointment also is active now. Right side we have the lots of handy because this application we made build in case of the like the people in the company they are using the desktop like large screen 32-inch. They are using laptops also, they are using the mobile, and they are using tabs iPad as well. So on that cases is user friendly. Then first appointment, if you want to take any new quick appointment, then patient file, call staff. If I'm calling on the call staff, so in the hospital like these are the groups are there, and we put in the backend is not just like a JavaScript hello. If I'm putting like if I needed to call the Dr. Nadir, so in the backend if I hit this button is there is a mic in the hospital and is doing the announce like Mr. Nadir please come on the reception, all this. So this is not a you are using the mic, is automatically we have some content in the backend, and we are using converting as in the voice message, that one. So if I need to come like call some Sherry as in the nurse, so then I can quickly click on this button, is sending the announcement within the hospital, and then the Sherry will, at least we have the one place they need to reporting on the receptionist. So then the next thing the reception will help them. Refresh page, so this is a old button we kept, but it's not useful because the Catalyst is already the serverless and very fast application. During the when I switch the screen, you can easily see how fast it is, but they are using the similar button in their old days application, and if they stuck somewhere they again refresh, then they refresh the reload the page. So but there is not any use in the Catalyst. If within the branch we need to transfer the patient here from the one branch, I can select any file name. Everything is start from the file number, there are civil IDs, so I can start with the file number, then branches within the which branch I need to destination. So within branches we can also transfer the patient. Go billing I will explain, and SMS I already explained here. So here we can see the quick insight, how many active status we have, arrived, cancelled, treated, totals. So it's based on the all branches and the date wise as well. We can put a filter, but these are the overall. Here you can see only the 4, but in the another date might you have the like 6 more. So that's why showing the 10 here. Patient reports. So when they get any, even the reception get any call, they can quickly search here the any patient here. If I search this patient file, it automatically fill the civil ID and submit. Normally it's very to like searchable action. We can give the mobile number wise also. We can give the passport number wise or any identity, like we have the country specific, so then we can use. So if I select any patient file here, so it allow me like I can click I can check which patient I need, so it generate the file for me also. Let me show you a few file formats. Peter, for any specific action we are generating the files?
No, please click on the file history and go with the same number. It might be generating report. Yeah.
Same number, right? Is 56. We had the data. I'm selecting the 57. Yeah. Okay, like that. So then these are the templates we designed for the quick insight in the reports for the patient. So like it's a date, then duration, branch, in which branch he treated, by doctor, purpose, and this is a fully customizable as per the requirements as we need. So these things we can manage as per the hospital requirement, and so there are some quick button also we put in the footer, so we can rename this as per the required solution we need to develop. So on the patient, we created here a like status. So then all this then is if I need to give like arrival, cancel. Sometime patient are saying no, we are not available. Can you reschedule this? Or did not show like they are not taking any call. So once we have created a patient and also assign a doctor there, like we assign the doctor here, all these branches, even we can track how many branches there, how many doctors are there, the status wise. So these are the quick filters we gave here. So you can put that filters also. So the same model we have for the call centers. It's not much difference because it's similar like the appointment. Only the changes are here we are following for the, if they get a directly call, we can connect via like any IVR solution, Ring Central, or like Twilio. We can use all the solution, and also we can record the call as well. Then the main module we have the after the appointment. So then we have the dentist. Dentist is a doctor, so who diagnose the problem for the patient. So all these files, like today we can see how many like all branches, all status I have. But when I log in as in the, if I'm the dentist from my access I log in, so whatever appointment is assigned to me, I can see only those appointments. So then doctor can edit the update, delete. Then they can also check the patient history from here also, and they can save the consultation, whatever consultation. Even the doctor can check when they need to call the next time if there is any reschedule of the appointment. So we can track here. So there are some doctor is like a salesman plus the operation delivery solution, as in the business perspective you say. So we are tracking the doctor's salaries on the basis of the some targets, doctor having the target, their treatment basis of commission, declaration, favorite treatment. So doctor can mark some, like if everyone having their expertise, so then they can mark some their treatment here, like which treatment he want to put in the favorite. So quickly he can suggest treatment list. They can check all these treatment list from here, like in English and in Arabic, both language we stored here with the code wise. All this appointment they can see. Patient app, like these are the patient appointment, bill collection and money, patient treatment and payment. So these are the finance part, but from here we can also track, like if any patient we have, I can filter here like how much money collected by a doctor. So this is the report came. So this is a total summary for this. Everyone can see there is a transparency between the doctor and the finance team. So they don't need to call again and again how much sales for the today and how much collection I did for today. So all these things they can see. So once the doctor feel some like diagnose solution they give, let me open the file here. Yes. So these are the, like if I attend as in the doctor I attend here is like is Mohammed Ahmed here. So I suggest the, like which treatment I need to give. So these are the like is 2 treatments if I need to give. So whatever is code and price we have, so then we are storing. So after this there are some lab testing they need to do. Like if I select this lab, 2 lab testing before any treatment. So here doctor have some good design view, and this design we created on demand basis from the customer side. We used again like React and JS. So these are the technical metrics. Only if someone in this webinar is related to the doctor, this the same dentist background side, so they can easily understand what is these metrics are there. But normally as in the layman, if I want to understand, if I attend any customer and it is my patient, so I can check in which teeth they have some issues. So then I can highlight those teeth here, and after this I save. So then the lab assistant know, so they need to take a sample from which teeth, and they need to, like normally when you come, so they need to take some capping on the teeth, or they need to make some modules. If you want to like change these 3 teeth, like front end teeth, you want to change there, so they can take some they have some plaster of Paris, and then they put in the mouth and take that sample similar like the your mouth, and they can make a same realistic teeth for your mouth. So once I save this, it show me some, if I need to put any cashier. So this patient having insurance, so any lab notes. So if I put any like test gums carefully, because sometime doctor got some cancer type of the patient as well. in the diagnose what they need, like is grounds. So these are the total price. This is just a like a basic initial fees for the checkup when a patient is at the hospital. You can see all this like this patient name, patient file, their patient sex is female, and upgrade to treatment. They have some plan also, like they are coming on the frequency basis, so we can manage all this one. I'm submitting this file to the lab, and then I'm going for the attend the new patient. So now one patient is appointed treated, and I can attend the next patient for me. Is file number this one. Now if I'm moving in the lab, so within the lab all these files are came for the lab technician. They're the separate lab. So all the status we are managing, everything we are tracking from the file number, and you can see there are some 2 digit, some 4 digit. So because there are lots of old file as well, in last they are using the 2 digit, but then at least we suggested the 4 digit, so that we can manage auto serial number. We can generate the file wise, there is a what is the price, total amount, quantity. So these are the lab technician status. So they are putting like they are after try, then is correction, adjustment, all the status between happening the doctor and the lab technician. So doctor, if they want to put any correction here, they can mark, and doctor can say yes, so they can do some correction. Sometimes what happen, your like teeth is not fit properly in the mouth in the when they create a demo, so that time doctor say yes, they need to some correction also. And if we print that report, so then the technician also can see the same reports. I think there's not any checkbox in this one. I need to go in the another patient. Patient in which Peter, in which patient we have the data?
From the top, third one. This
File 36 is not there.
you can choose unpaid also. The one that you created will be in unpaid because the customer may not be paid.
Okay. So we have some quick filter also, active labs, partially paid, and the unpaid also. So let me open the unpaid file. No. We tested Peter. Which one we tested?
The same one. Actually. Just go forward refresh. So the cookies might be stopping it, just load the page.
Yes, in the
But it's the same.
no. Please,
Yeah, please.
please go ahead. In the meantime, while it is loading, I would like to ask the audience, like, if they have some questions
Yeah.
for Balvinder up until now. I particularly
Okay.
liked I particularly liked that whole model of the teeth, and that's how I think industry should work. They should do less work on operations and more work on treating patients. So if you have any questions for Balvinder in the meantime, please do put it in the chat section. We'll be more than happy to answer them for you.
Yeah, I can see all these questions. So guys, definitely like Anand Singh, thanks for your question. So yes, it's possible. We can go inside your operations, and then we can customize this. So Zoho Catalyst is like a fully customized. You are also saying you are already using the Zoho One plan. So like wherever the operation gaps we have and the advanced thing we need to put, so all these operations we can manage within the Zoho Catalyst. But yes, it should be also sync the data within the Zoho One application, because the platform is the same. So then we have these type of the files. So there is not any much data, so that's why for the lab technician out there. Otherwise, the lab technician also can see the same checkbox what they need to diagnose, all these things for the lab's reports. So they can take some actions. Then once they complete their status, so then again patient came back to the doctor. Then doctor gives a few more correction. So these are the like repeated things until the like patient is not treated well. Next, then we have the some quick. Okay, that is the always I like this thing is really good in the Catalyst like theme we design. Easily, normally instead of the giving the left side the too much modules. So we are putting, like, if I am the lab internal here, normally if I go uh, like in the some solution, so then we must need to put the active labs here, then partial lab paids here, then unpaid bill also here. But within the lab, like instead of giving the new sub modules here, you can easily track here. So it's work like very fast, and also we don't need to create a multiple left side panels for it make the like loader is more heavy. So then we have the billing system is directly synced with the Zoho books. The doctor and the lab technician, they submit all these what type of the uh, problems they diagnose, what is the cost for this. So we can track the unpaid bills, we can track the paid bills. So all bills we have the what is the patient name, then English name, mobile number. So all these things we can track here. But everything start from the unique file number. Even if you search via name, we are not giving anything, because might be lots of people with a similar name. If you give any mobile number, sometimes they put a like is a space, or sometimes they put a +9 +01 like that. So that's why the patient must need to just take care like the file number. But admin can search also their mobile number and the civil ID number also, the unique we put. So we have the two search option, mobile number and the civil ID. So here I can see in the 56. So this is the invoice is unpaid here. They need to, if they want to claim some insurance also, it depends on the insurance companies. You have the hospital having the tie-up, and we can offer the insurance mechanism with the sometime what happen, you get like a $10,000 treatment, and but insurance company approved only the $7,000. So $3,000 customer need to pay via cash or via card. So both partially payment also we are receiving in this one. So this view is totally changed, but in the back end is the same mechanism. We are syncing as in the sales. Once one bill is created, so we are creating the invoice in the Zoho books, so that we can track on the daily sales, and for finance purpose in the back end is track all this or following all these accounting standards. So these are the quick for the billing side. And if I'm coming in the team marketing, so like we are syncing the data on the basis of the patient cart value. If you are offering some this is something like selling the insurance policy also. Like today I'm coming, so tomorrow I'm getting some message for my family, like I can come with my wife tomorrow, then I can come with my children tomorrow, like that. So all this digital marketing strategy we are making for the customer, and then customer then integrate with the marketplace. And but here we need to create some more tags as per the business strategy. Like these are the premium customers, but these are the like if under that particular type of the old age, like 50s normally, like is a deep problem starting from the 35 or 45 old ages. So all these tags we can create, and we can create a mailing list and in the Zoho marketing automation, and keep posting all these solution to the patients. So these are two-way sync. Human resources, we are creating all these employees, but all these employees automatically sync from the Zoho people when a new employee is joined. So that is also create a new employee here. All attendance is happening in the Zoho people, but here for the user purpose, what permission we need to give the admin, developer, or like doctor, then nurse, all this permission we are tracking here on the basis of the role like they hired in the Zoho people. Accounting, there are some service render, doctor revenues, these are the report purpose. Fund request also, they have some trust, like if there is a large organization, they have some trust, like how much if you want to give some discount, or like completely aid like 10%, 100% we can put. On that basis we can manage the like fund. If there is again the $10,000 is the total treatment cost, and trust give the fund for the $2,000 as in the donation, or $5,000, so rest amount the patient need to pay. So but they must need to get some approval from the trust side first. There is a bill control, we are managing all this bill, we are syncing all these bills. You can see their daily ledgers, how many transactions you have, like it's a free pay, like it's a cash ledger, there is account. So these are the payment modes. Also we can manage some chart of account, we can sync from the Zoho book, so that you can particularly tag like this sales. Normally this hospital is for the dentist, but as with the comment we have, might be there is a multi-specialist hospital, so then we can segregate the revenue on the basis of the treatment. Like there is a it's a heart surgery, and this is another lungs, there is another general OPD, all this. So we can segregate here also and give all these 4 tabs I shown on the top, so then you can easily track the revenue. These are the reports. We have the lots of reports here for creating the patient treatment, and within the model we have directly, but in the accounting all this report we already gave in the Zoho books, so that's why we are not making any duplication. Managers having some good models here, so fixing some advances is not more popular in the whole business, so that's why we are ignoring. Doctor schedules, they can create a quick doctor schedules also, like if I need to set up schedule any doctor shift for any particular date or particular month, please set in advance. Might be some, let me edit any reschedule. Sorry, might be some, because this is the tested, but we have the demo project. So if I need to select here that these are the shift, so there is HODs in the department, they can shift here the create a shift, what shift to the which shift. So in that basis we can make a rosters, and we can calendarize view also. We can give like how many shifts a doctor manage, if any doctor come in the leave, so then who gonna manage or treat their patient. So all this mechanism also managed within this. Price offer, this is related to the marketing side, so they can create a price offer like between the that particular season, like normally the people are coming for the treatment when they are on the holidays in the after Christmas and the New Year holidays, or any Eid holidays or any Diwali. So all these festival you guys can create an offer. This offer in from which period to which period, description, and offer is active or not. So on which product you want to create offer is not must for the entire product. So for which branch you want to give this offer, start date, offer end date. If I'm running this offer from the 1 to 15 actives, so if I put here the Slamia branch, so make sure whatever patient I have related to this branch, so they get as in the inform, so they can take a benefit of this percentage offer. I can put a 10% off here. Then lab treatment, if they want to do any lab option, so I can select the, for these two I can offer here the 15% discount on this, and I can submit a offer. This offer later we have the plan to develop their website also on the Zoho Catalyst, and this offer also live on their website. But for now we are offering this like directly sending this offer via email and WhatsApp only. For the administrator, we have the a separate administration, means you have the setting button, but they want the customer need like let's just put here as they have their old system the similar, so they request is for now just put here, but all this model will go back end in the setting here. So here they can create a multiple branches. If they have the new branch, they can create a new branch, how many branch they are running the businesses. Treatments, this is the service master, you can say the item master in the Zoho one, in the Zoho inventory or books if you are using, or like it's a product master. So it's based on that they are creating all the treatments. Treatment form, if I'm quickly showing you, like it's treatment code, if this is a lab or operation, so what type of the treatment is this, I can select here Arabic name, English name. Guys, we are not using the, I know it's very basic question might be from everyone, why if I'm putting the Balvinder Singh here, so why I'm not able to convert as in the Balvinder in the Arabic. So easily most of the language we can use the Google Translator in the backend. So Zoho Catalyst having the same functionalities, we can give all these capabilities we have, but Arabic is the language, it's very hard to convert in the English to the Arabic in the correct grammatically. So that's why they say no, we already having our Arabic expert, and they put a correct name here like that. So next is the lab operation, so we can create a lab. Devices, so like from which device we want to control, so we are giving all this like type of the devices. Device is something like an asset for this. Then we are putting even very soon putting some QR code also. If any machine is used particularly like 500 hours, so there is a service normally is happening in the surgery case. So after 500 hours or 1000 hours that is machine is done, So there is some type of this service need to be created for that machine. So all this notification we can manage in the devices. Lab technician. So these are the guys quick. I'm skipping the few things due to the time limitation. So even for the master also, okay, Zoho Catalyst having the already like is encryption level of the user and ID and password. But on the basis of the request also, if you want to manage the username and you want to store the password within the team, so then you can manage. But normally it's not preferred as on the Catalyst side. So we have the encryption, even no one can see, even as in the super admin cannot see the password. They can only change the password, like the Zoho one having the same practice. Now the users, we gave the very easy role and permission how they can set up. They can put up the name of the role, and it's a patient module. All these modules we have in the left side. So then which module access you want to give them. So you can build your own role and permission easily. So all this module we are tracking, and then you can create a new role, and then you can assign the person. I want to give the name, so that's why it's give the error. But all these roles we can create. Insurance companies, if you have the types with some insurance company, we can make all these masters, what is their policies, so that patient can go on through before all this treatment. Even we can give the access in future for the patient also. There is they can like get all this notification, what is the treatment, or when they can book the next appointment as well. So we can give the mobile application for the patient. That is in communication with the customer. We are already being in touch. So categories offer. So these are the all settings buttons we have. Even in the backend, if I coming here, so these are the like role and permission, employee profile setup. So all the settings model we have. So that's thing from guys our side, and now we are open to take all questions. So
sorry
Akshay,
for you,
if
the lab, internal lab, the image was
yeah,
coming. If you go there, third
okay,
one,
yeah, like
front,
quick face.
from the top, from the top,
where
third one, the current list.
Third one.
Yeah, you can take
This
it.
one. Let me try. No, I need to do a hard question. Gautam, Akshay, any question from you guys? Side?
Yes, like I would like to know more about, I think our audience also would like to know, about how, healthcare industry obviously comes with the challenge of migrating a lot of data from the previous platform to the current platform, right?
Oh.
So how did you manage, did you encounter the challenge here as well? And how it did in Catalyst?
If good. That is a good question, because as in the hospital are the like continue ongoing in the business. So for that specific case, we developed in starting that software. So they are using the Oracle, and there is a 4 million rows are there in case of the data. It's 40 lakhs, like 4 million. So before start the project, we gone through in their backend, made all these templates, help them convert in the XLS and the importables. So now the data is imported like that. So all this like we build all this capability, like import this large data. Normally, if I'm coming in the Zoho one or any other application, in the Zoho specific, we have the limitation. At least in the Zoho books, you cannot import like 1,000, 5,000 rows in a one time. But in the Catalyst, in the handling the large data, we have the 1 lakh, 100,000 rows in a one shot. So that is the same
Yes,
of time.
thanks to Catalyst. So glad to hear that. I think this must be one of the major concerns of anyone who's dealing with a healthcare client, right? Anywhere in the region, the loss of data and the data migration itself, makes a lot of people hesitant about changing their systems or looking for new solutions. Whereas in Catalyst, like just from our partner himself, very easy and it is very seamless. And the solution that we also saw was very, smooth in transition, right? Like no one even would probably have any problem to navigate or look or understand. It's very, straightforward and very specific and customized to the data, which is where, our first poll question also, right? If you've ever had to retrofit a vanilla product to a particular industry comes with its own set of challenges.
Okay.
I think that brings us to almost the close of the session. Right, it was such a exciting session, especially because we've all faced these challenges. Well, we have gone to different, hospitals or dental clinics, and it's really nice to see how Catalyst is working on, patient care delivery. So really excited to see this, and I'm sure our audience also really enjoyed it. And thank you so much, Balvinder. Thank you so much, Peter, and thank you all for joining today and making this session really special for us. Thank you.